Now let us talk about the neonatal seizures. There are metabolic causes, infective causes, and ischemic causes which can be responsible. And when they call neonatal seizures, which are occurring within the first 28 days of life. And hypoxic ischemic encephalopathy can be responsible, especially those who are premature infants. Similarly, intracranial hemorrhage, subarachnoid hemorrhage, any of them can lead to neonatal seizures. Pyridoxine can be responsible, that is the reason 50 to 100 milligram IV of pyridoxine with the electroencephalographic monitoring, if you do, the pyridoxine dependent seizures become resolved. Similarly, hypoglycemia, hypocalcemia, hypomagnesemia, they are all the various metabolic disturbances which can be responsible is what need to be remembered. Now what is the time gap which is being given in the train of force stimulation? In the train of force stimulation, we apply 2 Hz stimulation to the ulnar nerve once every 10 or 20 seconds. So 10 or 20 seconds means 10 seconds gap. So that way probably A should become the most possible answer. 10 or 20 seconds gap we basically applied. Then what is 1 Curie? Fundamentally the older unit of radioactivity is the Curie. It is 3.7 into 10 to the power of 10 becquerels, that is 37 gigabecquerels is what has to be remembered. Quinsy is the peritonsillar abscess. Why this question is asked? Because 2 marks. At least you should get out of 200, right? Now what is the most common cause of persistent diarrhea in children? How many answered it as respiratory syncytial virus in the exam? RSV fundamentally causes acute diarrhea. It does not lead to persistent diarrhea. Toddler's diarrhea is in fact the most common cause of the persistent diarrhea, which is caused by the diet. But diet was not mentioned in that, in the options given in the exam. So persistent diarrhea means any acute episode which is lasting longer than 14 days, 2 weeks of duration is called persistent. So there was one of the landmark paper which was published in the pediatric clinics. So there is a study done in India, Peru and Bangladesh to know what is the etiological agents responsible for the persistent diarrhea in the infants. They found that the enteroadherent E. coli are the ones which are the most predominant strain in the case of both persistent episodes and also in the acute episodes also in fact. Though the respiratory syncytial, the rotavirus is there, still the most common would be the enteroaggregative E. coli would become the correct answer. Now the oxygen delivery will be least whenever there is a histotoxic hypoxia, like a carbon monoxide poisoning where the delivery becomes impossible. Now the blood flow to the brain is definitely decided by the PSCO2 and also by the blood pressure also will decide it. Though there is a range of the BP where the autoregulation of the cerebral circulation maintains it, still beyond that limits of autoregulation definitely BP has got an influence upon the cerebral circulation. There is a reason very severe hypertensive individuals can go into hypertensive bleed and a hypotensive individual can go into cerebral ischemia and shock and comatose state. So very much. But oxygen directly is incapable of influencing the cerebral circulation is what need to be remembered. Now what is the least plasma half-life that you come across? Epinephrine and norepinephrine have got a half-life which is very short, which is only around 1 to 3 minutes. And they are eliminated completely within about 15 to 20 minutes. And the aldosterone's half-life is around 15 minutes in circulation. And the cortisol's half-life is around 90 minutes. That way the shortest becomes the norepinephrine is what I want to underscore to all of you. Where do you see the Maltese cross in the RBC? If you look at the Babesia, in the erythrocytes, what are the only 2 organisms that you know which are intra-erythrocytic in their presence? Plasmodium, other is Babesia. So the Babesia organisms will be hanging like 2 pears and that creates this Maltese cross-like appearance on the so-called microscopic appearance is what need to be remembered. Maltese crosses. Then what is an epicolic note? So please remember, doctor, even you are the best aspirant for the entrance, all questions cannot be answered only by reading. That is the fundamental truth, let me tell you. I mean, at least for the next batch of students. You need to use your common sense, presence of mind, your clinical experience, how well you worked in housemanship. For example, 10% glucose, hypertonic or hypo or normotonic. Does it require, what is it called as reading in Bailey and Love to answer to that? Not required. Similarly, what is the common cause for the death in the first day after shock? I mean, after burns. Hypovolemic shock is a very common clinical practice question. So, everything cannot be answered. Probably, what is the influence of hyperkalemia on the resting membrane potential? It requires a proper mugging and a binocular like spectacles in the reading room. Since you put student can only answer. But once more, it also requires presence of mind, let me tell you. So that's the reason, try for that. That actually, it's like a lifetime safeguard for you. More than worrying about this many facts are there, I need to remember all of them, and this many hours I am unable to read. So quantity is not always needed. Qualitative, open-minded outlook, that is much more important. Even as a clinician, practitioner, tomorrow you are all becoming MD and then you practice. It's more of a, if you say that I have done PGI Chandigarh gynecology obstetrics and your patient dies because of the absence of the blood in your blood bank, nobody cares whether you are from PGI or anywhere. Finally patient died. So it is your common sense, presence of mind which will say that I must make everything ready, prepared for all emergencies, etc., etc. So that is what. So epicolic note, very rarely people can answer by answering it in the, studying in the book. Basically, doctor, if you remember your anatomy days, you have a colon. Colon has got two ends, this end and that end. What is that end? Mesenteric side, mesocolic side, and the one which is not on the side where mesocolon is attached. So you have some lymph nodes on the other end called mesocolic nodes, and some lymph nodes directly on the wall of the colon which are called epicolic nodes. And why is this important? Tomorrow as a surgeon, if you see carcinoma of the colon, it initially goes to epicolic nodes, then goes to mesocolic nodes, then it will be going to those nodes which are there along the branching vessels coming out of the aorta. Perivascular nodes will be there. So finally it will be reaching there. So that is the reason. So adjacent to the wall of the colon is what you find, the epicolic nodes is what need to be remembered. Human Development Index is a very standard question. Per capita income, life expectancy of birth, that is the kill. Knowledge, income, literacy, they are the important different factors. So this is another common sense question. Glycogen storage disorder which does not involve the muscle but involves only the liver and kidney, which is the one. So the glycogen storage disorders type 1, also called the von Geig's disease, all of you know that there is a lactic acidosis, hypoglycemia, convulsions, they are all the important presenting features. And why it does not involve the muscle and only these parts? Because it is due to the deficiency of the glucose 6-phosphatase. And that will prevent the glycogen from being degraded, and that causes the deposition of the glycogen in the hepatocytes, kidney and the intestinal mucosal cells. And that is the reason clinical manifestations of the liver and kidney are the ones which dominate the clinical picture than that of the muscle problem in the case of the von Geig's is what need to be remembered. Whereas if you take the glycogen storage disorder type 2, it is the muscle involvement with a profound hypotonia which also involves the respiratory ventilatory muscles which can lead to development of loss of ventilation. All this can become the problem. Now what is so characteristic of pregnancy, doctor? Chiasma is the very characteristic feature. So with this we will conclude the today's session, and I wish good luck to all the aspirants and no disappointments, no heartfelt feelings for the mistakes done. It is a part of the game. Only thing is you should keep going on, moving on and on. Dream about What is next to this? After the Kauravas and Pandavas are dead, there is one more episode which will start, right? So aims will come, Nimhans will come, and suddenly if you get seat next day, remember that life is not once more the cakewalk. As a postgraduate, you have to move along. You have to pass. After that, you have to settle as a clinician. Prove that you are the best clinician. So many ingredients are there. Finally, you should enjoy all phases of life. Thank you, doctor.